What you're about to see is a shift in the paradigm of the way we treat patients. The patient we have today is actually one of the most dramatic examples of what LUMINEERS can do for you and for your patients in expanding the parameters of your treatment. If you take a close look at his before pictures, you'll see he has a great deal of space between his teeth, some diastemas. He has some nice crowns in his mouth. He just got them. If you look in the buccal corridors on either side, you see that the dentist he goes to is a good dentist. And when he got finished doing these beautiful crowns, he started looking at his front teeth and started suggesting doing something to those. This is going to be really a good case because I'm going to try to show you when we get finished, we'll have a stress-resistant, non-microleaking margin that is created by the restorative Ultrabond. Now, the first thing I want to tell you is that you need to be prepared. Lisa has already polished the patient's teeth with the porcelain laminate polishing paste right here. The reason we like that is it takes off the plaque better than pumice. So the patient's had his teeth polished with that. She also has the LUMINEERS, and you see they're prepared, and she's treated them with the Serenate Prime and with the porcelain conditioner. The porcelain conditioner is applied first. It's important that you apply these in the right sequence. If you skip one of those steps, instead of getting a bonding agent, you will get a releasing agent. Okay, we'll etch first. I like to put a little dab of etching agent on each tooth. Then after I put the little dabs of Etch N Seal on, I push it around with my brush. This way I have more control, and it doesn't run all over the patient's mouth. So then we'll wash off the Etch N Seal. I like to use Etch N Seal because it has aluminum oxylate in it. And now you see we have a frosty appearance. Now we're going to use some paint on dental dam. We have to be a little careful here that we don't get too much of this between the teeth, or otherwise it'll get in the way of seating our LUMINEERS that go to the lingual side a fair amount. Close your eyes. All we have that there is a barrier, so when we apply the Ultrabond, it'll prevent it from getting to that part of the tooth. Now we're going to apply tenure AB. And as you can see, this is a very simple procedure. Use a copious amount of tenure AB. And what tenure S will do is it protects that treated surface from contamination. Tenure S on these scubies that you see me applying to the teeth. But see how simple this is to place this? Now contrast that with a dentist looking at him, a good dentist, sincere dentist, telling what he would have to do if he were going to do veneers for him. And what I'd like to do is I'm going to do a fixation on these that I've placed so far so they won't go rattling around on the right central, not the left central, and I'll tell you why in a moment. Close your eyes. The best protection is to close your eyes, to protect them. Making sure we have the LUMINEER placed in the right place. Left lateral. And the reason I don't want to on the adjacent tooth is sometimes a little bit of that light will cause some of the material to polymerize. Now we'll take the, close your eyes. Okay. Close your eyes. Close your eyes. Okay. So I'm removing the paint on dental dam. Now we have all these contacts are fused. So the first step to opening the contact, this is where you want to use the finishing kit. And I'll begin using the 12 fluted burr. The reason I like the 12 fluted is that it removes the ultra bond and it doesn't remove the porcelain. And I'm taking out the ultra bond because when I open the contact, I want to have as little composite between the tooth and between the porcelain and the tooth. Now the next step is we'll take the Schure 349 instrument. Let me show that to you. Never use your hygienist scaling instrument because if you do, you'll scratch this glazed porcelain. We don't want to scratch the glaze. So by using this, even though I'm putting a lot of force on here and popping off the ultra bond, I won't scratch the porcelain with a Schure 349, and that's in the finishing kit. We just come over here and a little bit. Now, if I don't get all the ultra bond off, and I never do on the placement visit, it flakes off during the week. And now we'll begin to remove some of the ultra bond on the lingual. And don't try to do these without water because you'll build up tremendous heat. Now we'll come back with a very important diamond. That's the needle nose diamond. And I'm just going to open up these embrasures a little bit more now with the diamond. And by having removed the ultra bond, I can see the difference between porcelain, ultra bond, and tooth structure with my magnification. Now what I'm doing is I'm taking this excess off and going between the embrasures, and I'm also removing the shoulder between the porcelain and the tooth. So we'll have a seamless margin. This is a Cerisaw. So what we'll do is go through this, and if you've never used a Cerisaw before, see how easy that was to open? Why was that easy? Because I took the time to remove the ultra bond from in between the teeth. In other words, if I have the right tools, this is a simple procedure. But what a transition has taken place in this patient's mouth in an hour. I'm going to test the occlusion right now. So we bonded the materials, close gently, open and close. Gently grind around. He's got a tight bite, so we got to be careful here. Sometimes it's just the ultra bond. Well, so far this looks pretty good. We've only got a spot in here on the central, and maybe that's ultra bond. It's ultra bond. See that? This one over here is a little challenging. See that over there on that space? We're going to have to do a little work over here on that diastema between the cuspid and the bicuspid. Open. Now we're going to take the football-shaped diamond and contour that. Now what I'm going to do is we start getting to the occlusion part. I'm blending all of the ultra bond and the Serenade porcelain and the LUMINEER. I'm blending it all, removing anything I don't like looking at for either cosmetic reasons or occlusion. Got a little bit in here. And I'm just blending so the margins of the ultra bond and the porcelain are all seamless. And so all I'm doing is using an ultrafine diamond. Now ultrafine diamonds are critical with water and a light feather touch. Now so far I haven't looked at his occlusion, I just wanted to improve the appearance of those lowers. Gently grind your teeth around now. So you can see we have contact on the occlusal, and we have contact on the lingual, and we have contact on that crown that he made. The change has been dramatic. Why don't we give you a mirror so you get to take a look? How do you like that smile, huh?